Hypertension is an epidemic affecting 1 billion people and is the commonest risk factor for death throughout the world. So, what is hypertension and how do you prevent it from occurring? We'll discuss this in the following video. High blood pressure is a common condition in which the long-term force of the blood against your artery walls is high enough that it may eventually cause health problems, such as heart disease. Blood pressure is determined both by the amount of blood your heart pumps and the amount of resistance to blood flow in your arteries. The more blood your heart pumps and the narrower your arteries, the higher your blood pressure. A blood pressure reading is given in millimeters of mercury. It has two numbers. The first number is called systolic pressure. It measures the pressure in your arteries when your heart beats, while the second number, called diastolic pressure, measures the pressure in your arteries between beats. You can have high blood pressure for years without any symptoms. Uncontrolled high blood pressure increases your risk of serious health problems, including heart attack and stroke. Fortunately, high blood pressure can be easily detected. And once you know you have high blood pressure, you can work with your doctor to control it. Most people with high blood pressure have no signs or symptoms, even if blood pressure readings reach dangerously high levels. A few people with high blood pressure may have headaches, shortness of breath, or nosebleeds, but these signs and symptoms aren't specific and usually don't occur until high blood pressure has reached a severe or life-threatening stage. There are two types of high blood pressure: primary, also called essential hypertension, and secondary hypertension. For most adults, there's no identifiable cause of high blood pressure. This type of high blood pressure is called primary hypertension, which tends to develop gradually over many years, while secondary hypertension tends to be caused by an underlying condition and appear suddenly. This type of hypertension generally causes higher blood pressure than primary hypertension. Moreover, many conditions can lead to secondary hypertension, including obstructive sleep apnea, kidney disease, adrenal gland tumors, thyroid problems, certain defects you're born within blood vessels. Also, there are certain medications that increase blood pressure as a side effect, such as birth control pills, cold remedies, decongestants, over-the-counter pain relievers, and illegal drugs, such as cocaine and amphetamines. Although there isn't a clear cause of hypertension, there are many risk factors that lead to high blood pressure. These include older age, race, family history, physical inactivity, smoking, consuming a high-sodium, low-potassium diet, drinking too much alcohol, and stress. The excessive pressure on your artery walls caused by high blood pressure can damage your blood vessels as well as your organs. The higher your blood pressure and the longer it goes uncontrolled, the greater the damage. Uncontrolled high blood pressure can lead to complications, including stroke, aneurysm, heart failure, chronic kidney disease, glaucoma, dementia, and metabolic syndrome. Your blood pressure is normal if it's below 120 above 80. While elevated blood pressure is a systolic pressure ranging from 120 to 129 and a diastolic pressure below 80. Elevated blood pressure tends to get worse over time unless steps are taken to control blood pressure. Elevated blood pressure may also be called prehypertension. Stage 1 hypertension is a systolic pressure ranging from 130 to 139, or a diastolic pressure ranging from 80 to 89. More severe hypertension, Stage 2 hypertension, is a systolic pressure of 140 or higher, or a diastolic pressure of 90 or higher. A blood pressure measurement higher than 180 above 120 is an emergency situation that requires urgent medical care. Both numbers in a blood pressure reading are important, but after the age of 50, the systolic reading is even more important. Isolated systolic hypertension is a condition in which the diastolic pressure is normal, meaning less than 80, but systolic pressure is high. This is a common type of high blood pressure among people older than 65. Because blood pressure normally varies during the day, and may increase during a doctor visit. This is called white coat hypertension. Your doctor will likely take several blood pressure readings at 3 or more separate appointments before diagnosing you with high blood pressure. Changing your lifestyle can help control and manage high blood pressure. Your doctor may recommend that you make lifestyle changes like eating a heart-healthy diet with less salt, getting regular physical activity, maintaining a healthy weight or losing weight if you're overweight or obese, and limiting the amount of alcohol you drink. Thank you for watching this video. If you enjoyed our content, don't forget to like and subscribe. See you next time.